Hi, my name's Riley, and today we're going to be going over the post-traumatic stress disorder. And these are the people I'm working with.
My name is Sydney.
My name's Tyler.
I'm Isaac.
And I'm Isaiah.
Okay, so to start off, the relevant data from the present problem, he had inability to sleep and nightmares, and this is significant because lack of sleep makes it more difficult to manage emotions, increases anxiety, and diminishes coping skills. If left unaddressed, this can result in worse mental and physical health. He also was experiencing flashbacks and heightened response to noises, and this is significant because these symptoms indicate that Marcus has unresolved trauma, which is making it hard for him to function each day. He often feels very alert and has intrusive memories, which can lead to increased anxiety and emotional instability. Um, he also said his PTSD medications have not been helping control his anxiety, and this is significant because this suggests that he may not respond to treatment, and we need to review his treatment plan, including both medication and therapy options. If the medications are not working, we might need to consider other therapies. He also has been experiencing spending more time in his room and avoiding interacting with his family. And this is significant because isolating oneself and withdrawing from others are strong signs of depression. And these behaviors can lower a person's quality of life, and they can also put stress on a family's relationships, which adds more stress for both Marcus and his family. Um, he also is experiencing survivor's guilt when he states he should have died and not his friends. Survivor's guilt and PTSD and depression can increase the risk of suicide. His comment shows that he may have suicidal thoughts which require immediate attention. The relevant data from social history, the death of his friend, and injuries from an IED explosion is significant because the loss of his friends and his serious injuries likely caused his deep sadness, survivor's guilt, and ongoing emotional struggles. And many veterans experience feelings of isolation, powerlessness, and heavy burden of grief that they may not have dealt with. He also is blind in his left eye and is experiencing severe leg pain and mobility issues. Chronic pain can increase stress and make mental health problems worse, like PTSD and depression. And when people have physical limitations due to pain, they may feel frustrated and dependent on others. And these feelings can make emotional struggles even harder to deal with. Um, he also was medically discharged and he has disability. And adjusting to civilian life after leaving the military can make people feel lost and lower their self-esteem, while disability payments can provide financial support. They do not address the emotional struggle that comes from not being able to work with or not be able to work or meet past responsibilities. He's also has moved multiple times with his family while he's been in service, which has put a strain on their relationships. And balancing military duties and family life can be challenging. He feels guilty and having trouble connecting with his family, and this guilt intensifies his feelings of loneliness and helplessness. He also reported he used to drink a lot, but now has been sober for 1.5 years. Even though he's now sober, alcohol may have helped him deal with his PTSD before, and without alcohol, he might feel emotionally vulnerable and may struggle to cope with his feelings without the support from a mental health professional. Um, Now going into his vital signs that are relevant, he is experiencing continuous aching left leg pain and worsens when moving. This is significant because Marcus experienced ongoing pain in his left leg, likely due to past injuries and shrapnel remaining in his body. This pain can impact his mood, sleep, mobility, and overall happiness. Managing this pain is important to reduce his stress and support his recovery.
Now moving on to the physical assessment data and its clinical significance. In the general category of the physical assessment, Marcus appears anxious, his body is tense and tired with dark circles under the eyes. And And these are consistent symptoms of PTSD. The dark circles and the fatigue are likely due to his sleep deprivation, which is exacerbating both his anxiety and other PTSD symptoms like nightmares, flashbacks, and with loud noises and social withdrawal from wife and his child. On neuroassessment, his flat affect, insomnia, nightmares, and flashbacks indicate severe PTSD, with the symptoms affecting his emotional well-being and daily functioning. And these signs suggest heightened anxiety, dissociation, and emotional numbing, which likely plays a role in his social isolations and feelings of hopelessness, as mentioned before. Nurses should prioritize safety during care and assessing triggers and frequency of flashbacks, and try to find interventions to address sleep disturbances, anxiety, and emotional processing to reduce his stress. For his appetite, he reports decreased appetite without weight loss, which may suggest that while his PTSD symptoms are affecting his eating habits, it's not causing severe physical consequences such as malnutrition. Decreased appetite is also a common symptom of PTSD, which can be linked to anxiety, depression, emotional distress, and contribute to a lack of motivation, which we can see in Marcus. His substance use assessment, his history of heavy alcohol use suggests that he may have been using it maladaptively cope with his trauma, pain, and anxiety from his combat experiences. And his decision to stop with his heavy consumption of alcohol is a positive step in the right direction, but nurses should be aware of the potential for relapse because individuals with PTSD have a higher risk of relapse during stressful times. Upon Marcus's mental status examination, his motor behavior of him walking with a limp due to his injury and no abnormal activity reflects his combat injury to his left leg, which causes chronic pain. And although he has normal motor activity, his mobility should be monitored over time. His mood and affect appears anxious. Patient states, "I feel nothing" most of the time, but also states that he flies off the handle a lot and reports he startles easily to environmental noise. His anxious affect, along with his statements of feeling numb and easily irritated, can indicate emotional dysregulation, which is common in PTSD. His comments of "I feel nothing" suggest emotional detachment, which is also a common symptom of PTSD, and his tendency to fly off the handle and startle easily may be explained by his heightened state due to anxiety and emotional instability, which affects his ability to cope with daily stressors and interactions. In his thought content, he denies delusions when assessed. He's somewhat guarded in responses, but no evidence of paranoia. He admits to intrusive thoughts about his time in combat and expresses guilt, as mentioned before. He wasn't able to help. He also states he sometimes thinks he should have died with his patrol. So he is experiencing intrusive trauma-related thoughts, which are characteristics of PTSD. His excessive guilt, including feelings of responsibility for the deaths of others and thoughts that he should have died instead, suggests survivor guilt, a common emotional response in trauma survivors. These thoughts contribute to his emotional distress and could increase the risk of depression, suicidal ideation, requiring further monitoring and supportive interventions to address these feelings of guilt and hopelessness as nurses. For perception, his flashbacks and visions suggest that he is experiencing dissociation and re-experiencing trauma, both key symptoms in PTSD. These intrusive perceptions, such as seeing hot flashes of body parts or reliving the IED blast, are causing him significant amount of stress, which can impair his ability to function in daily life, showing the need for intervention to help him manage these intrusive memories and reduce the impacts on his mental health. For the insights and clinical judgment, his statement, "Nothing can be done to help," shows us a look into his current mental state of feelings of hopelessness, which can be a barrier in the recovery process. This increases his risk for depression and suicidal ideation, so So it will be crucial to address Marcus's emotional and mental health during his care. For the cognition section of the mental status examination, the oriented ×3 has some memory problems associated with the exact events during the IED blast, possible traumatic brain injury, and reports sometimes having a difficult time concentrating. This suggests possible traumatic brain injury from his combat experience. His difficulty concentrating can be linked with cognitive impairments caused by the blast, or from the emotional distress he experienced. And this is common in veterans with combat experience. And this is important to monitor as a nurse. As mentioned by Riley and I before, suicidal or his statements that he thinks that he should have died instead of his colleagues indicate survivor's guilt, which increases the risk of him developing suicidal ideation. While he denies current suicide or homicidal ideation, his feelings of guilt and past trauma require close monitoring for any further changes in his mental state or potential escalations of these thoughts. Now moving into diagnostics results, all of his lab results were within normal range. The sodium, this is significant because it indicates that Marcus has proper fluid balance and no immediate concerns related to electrolyte imbalances. The potassium was within normal range, suggesting that his heart and muscles function, or that his heart and muscle function are likely unaffected by potassium imbalances. His glucose is within range. His creatinine is within range. The CBC is within range, which shows no active signs of infection or heightened immune response. His neutrophils are within range, or his neutrophils were within range, but they were slightly elevated, and that could be because of a mild infection, or in his case is very much likely due to the amount of stress that he's experiencing. The hemoglobin, the platelets, the acetaminophen and salicylic tests all came back normal or negative, and the drug screen was negative, which supports his statements of no current drug use.
Okay, so kind of pulling it all together and all the assessment data, we look at the patient's primary issue, and it is post-traumatic stress disorder, or PTSD. So I'll go ahead and explain the pathophysiology behind it. So after exposure to a traumatic event, the body experiences episodes that trigger a fight or flight response by the sympathetic nervous system. Individuals with PTSD experience a hormone imbalance where adrenaline stays high in their systems and cortisol, the hormone that normally brings you down after a high stress response, is deficient. The patient will experience flashbacks and nightmares, causing them to relive the event, which ultimately causes long-term dysfunction. So some of the collaborative care and medical management, the patient will be admitted voluntarily. So this allows the patient to have control over their situation and acknowledges that they need care. And the outcome would be that the patient will not be forced into healthcare and they will maintain their autonomy. Initiating milieu therapy. Milieu therapy is important because the individuals are very vulnerable and in an easily triggered state. The outcome for this would be that the patient will have an environment that is calm and adjusted to their specific needs. Third is initiating safety measures according to unit protocol, including keeping environment free of dangerous items and maintain regular close observation. It is necessary to take these measures because of the patient's surroundings and the personnel. Safety of the patient and the surrounding personnel is the first priority. And the objective here would be that the patient and all of the other patients surrounding them and the healthcare workers are all safe and unharmed. Fourth is the vital signs every shift while awake. This is to determine if the client has deviated from their baseline vitals or if they are having any sympathetic nervous system responses. So maybe they're having an episode or something's being triggered, and maybe the healthcare provider could catch this. So the objective here is that the healthcare personnel will monitor and continuously assess the effects of the new medications and changes in the patient's condition over time. Paroxetine, 40 milligrams daily. Paroxetine is an antidepressant medication that is also used to treat panic disorders, anxiety, and PTSD. So the objective here is the patient's anxiety and PTSD symptoms will be reduced. Prazosin, 4 milligrams, POHS. Prazosin works by blocking alpha adrenergic receptors, inhibiting the body's stress response, and reducing the hypervigilant state that people with PTSD often find themselves in. So the goal here is the patient will not experience unnecessary stress responses, and hopefully the medication will help with that. Mirtazapine. Mirtazapine is a tricyclic antidepressant medication that works to reduce the symptoms of major depressive disorder. So the goal here is the patient will experience reduced symptoms of depression, which is often a comorbidity with PTSD.
Okay, so now I'm going to focus on some of the nursing interventions for this patient. And our nursing priority is ineffective coping related to lack of confidence, inability to cope, as evidenced by sleep disturbances and changes in behavior. And the reason I say lack of confidence, inability to cope is because the patient stated that there's probably nothing that can be done to help them. So we kind of need to build up their faith and confidence that they can build those coping skills. So one of our nursing interventions will be to continue assessing for self-destructive habits such as drug or alcohol use, or self-harm or suicidal ideation. So since the patient has PTSD and also has a history of alcohol use, there's assessing them for kind of these self-destructive habits increasing or becoming more of an issue is definitely important. And our expected outcome for that is that they will not be using harmful habits to cope. Our second intervention will be to refer them to a mental health therapist. So an LPC or other mental health therapist or specialist who's trained in PTSD, they'll be able to help them develop, short-term and long-term healthy coping strategies, especially since we're nurses and we're not going to be seeing them as long as a therapist potentially might. That's definitely kind of like an important support system for them to get. And then the expected outcome for that would be for them to have the opportunity to be referred to a clinical mental health specialist if that's what they want. And our third priority intervention is explore the patient's current coping strategies and teach adaptive strategies such as relaxation, meditation, or positive reinterpretation, among others. And the rationale for that is that the patient's current coping strategies can be used as kind of a starting point for educating them about further healthy coping skills that resonate with them and work for them. And our outcome for that is that the patient identifies their current coping strategies and is assisted to determine new coping skills that will help them in the future. Our fourth intervention is to encourage the patient to explore their feelings of grief, loss, and stress. Helping the patient open up about their emotions and feelings in a safe environment can improve their ability to cope with the emotions, as well as identify causes of the stressors and triggers for their stressors. And we want the patient to feel comfortable and able to express their emotions safely in the environment that we're making. And our last nursing intervention, which is pretty important, is to develop a safety plan with them. Safety plan while they're at the hospital as well as after discharge. So since patients with PTSD have elevated risks of self-harm and suicide, it's important to develop a safety plan. And we'll want to go over things like safety risks at home, such as if they have a gun, things like that, emergency resources, and coping skills they can use in an emergency. And the priority would be or the outcome rather, would be to have the safety plan developed with their input and have it to be something that they understand and are able to use when they need it. So let's focus on some psychosocial priorities. So their main priority for their psychosocial or holistic care needs is to have their anxiety, isolation, and depression all decreased. So when we're looking at their comfort, it's important for us to actively listen to the patient and ask them to share their feelings, kind of make it like a healthy environment and somewhere where they feel safe opening up. So we want to practice actively listening and restating points of concern, and that really shows the patient that we're there and we care about what they're telling them. We care about what they are telling us, is what I mean. And yes, so our outcome for that would be that the patient feels comfortable and willing to share their feelings. And we also want to have a low stimulation environment for their physical comfort, because reduction in stimuli can lead to decreased anxiety and agitation. For emotional support, we want to develop therapeutic communication and include the patient's family. So we should be using therapeutic communication whenever we're interacting with the patient or family members. And we should include the family members to allow the patient to feel more comfortable with the plan of care once they get back home. For spiritual care and support, most of this would be focused on figuring out what the client's needs are, because we don't really, we don't know at this point. So just asking open-ended questions about what spirituality means for them and what kind of needs they have, such as, how is your current situation impacted by your spiritual beliefs, or do you find strength in any spiritual beliefs or practices? So we definitely want to focus on, kind of what the client wants and not our assumptions about what they would want. And we also want to um, give them the opportunity to talk to any spiritual leaders or anyone like that that might be important for them to interact with during their care, as well as if they have any spiritual practices, kind of giving them time and space for that and supplies if they need them. And we want the client to feel that the care team is aware and respectful of their spiritual beliefs and have access to fulfilling their spiritual needs. And then we don't really know that much about the client's cultural needs, but they are a veteran, so referring them to like veteran specific support systems, support groups or people that might be more informed about that specific type of thing would be nice. And we also want to inquire about how the patient's culture impacts their care and current needs, so we can be culturally competent in our care. And we want to just ask about their identities and ask how they impact their care. And we want to respect that and incorporate their cultural identities and needs into their holistic care.
All right. So, just to kind of wrap everything up, what education slash discharge priorities need to be addressed to promote health and wellness for this patient? Just kind of touching on the priorities kind of from each section that we went over. So, effective coping practices such as meditation and proper expression of feelings needs to be discussed. Reaching out to referred mental health therapists is also is a priority, as they'll be more qualified to work with the patient regarding their mental health and thinking patterns, and maybe able to work with them longer, as Isaac stated. Medication education for some of the drugs that Isaiah had stated, and education on the management of chronic pain, including certain medications and non-pharmacological methods. Educating Marcus on the importance of good nutrition and sleep hygiene can help support both his mental and physical health. A balanced diet and regular sleep patterns can help reduce stress and improve mood. Going to bed and waking up at the same time every day, even on the weekends, as well as avoiding naps during the day, can help to regulate his circadian rhythm and improve nighttime sleep quality. Creating a calm, dark, quiet sleeping environment can help to reduce stimuli that may trigger anxiety and nightmares. Clients with PTSD have found that white noise machines during sleep to finding using white noise machines during sleep to aid in restful nights is very helpful. So, and then educate about signs of serotonin syndrome caused by medications that could be included in his plan of care. Some of these signs are confusion, muscle spasms, insomnia, sweating, and trembling or shaking. And if he notices these signs, he should seek immediate medical attention, as it can be possibly life-threatening.